Yama, hello and welcome to Blacademia. Joining me today is a very special guest. I'm going to give her a slightly longer introduction than on the other episodes. So while every job is important, and particularly during COVID, we learnt this or we were reminded of this as a society, that cleaners, garbage disposal and garbage management people, teachers, healthcare workers, all of these jobs are very valuable and contribute to the care of community. Some jobs, however, are literally life and death in their day-to-day. And today's guest has saved my life personally. I've only had surgery 2 times, and both times Dr. Leila was in the room, and the second time she literally saved my life. So a very special Blacademia would not be happening if it wasn't for welcome to Dr. Leila Usher.
Oh my gosh, Amy, how am I supposed to respond to that?
When I was like driving home today to get ready to record with you, I was like, this is going to embarrass her, but I'm going to do it anyway.
I don't know, it's not embarrassment. It's like, I do that stuff sometimes because it's not what I'm thinking about when I'm doing it. I can tell you that much. But no, that's very humbling. So thank you for that. That's very, very humbling. And I'm glad I was there.
Me too. I'll touch a little bit more on it later on in the episode, but would you like to introduce yourself? So who's your mob and what are your qualifications?
Anikanya, guys. My name is Dr. Leila Usher. I am a Wonnarua woman and I have a Bachelor of Medicine through the University of Newcastle, and I also have my FRANZCOG, which is a fellowship of the Royal Australian New Zealand College of Obstetricians and Gynaecologists. So I have my specialty letters, which is cool. And I work in a few different places. I work at John Hunter Hospital, which is the tertiary centre for really a large chunk of New South Wales. We go from the Hunter Valley and Newcastle area all the way up to the border, essentially. And then I also work at the Awabihor AMS as an outreach clinic for women's business and mums and bubs. And I've just started some private work. So many, many things that I'm doing all at once.
Well, I'm so grateful for all that you do. Years ago now, when I was just in pain all the time, I had been sent to a bunch of pale, stale male doctors, for lack of a better way to phrase it. And I didn't think I had women's business issues. I just knew I was in a lot of pain. And I remember saying to my GP at the time, can you just send me to a woman? And she was like, what do you mean? I said, can you send me to a woman's specialist? Because all these specialists you keep sending me to try and get to the bottom of the pain, they're not listening to me. Like I get in there and they just start saying that they think I have anxiety, which I do. But I don't think that explains why I'm having these really intense physical symptoms. And I remember sitting there and going, well, we've got Dr. Leila. She's a gynecologist, which I don't think you need, but you could go and see her. And then I remember the contrast of I don't think you need to see her to when I came into my first appointment with you and you go, you've read your own medical files? I said, no. And you were like, all the doctors you've seen have basically just said in all of their files, yeah, you've got symptoms, but you're anxious. So, oh, well. And then you were like, do you think that you have endometriosis? And I was like, I don't know what that is. And you're like, I think you have endometriosis. And so I remember you saying, we're just going to pretend you haven't seen any of these people. I'm going to disregard all of this and I'm going to go over all the questions with you. I did. I did have endometriosis. I needed surgery. It was a whole thing. And it was life-changing. The reduction in pain and like debilitating, day-ruining symptoms that I was experiencing all the time, because it was every day for me. The change that made in my life was huge. But in the lead up to this surgery, I was so scared because being in the public health system, there was a really long lead time. And then it got delayed again. And the new date was my birthday and it was my 30th. And so I was getting really scared. And then I got another letter saying, and we're going to move hospitals. And they moved it to the hospital I was born in.
Oh
and
my goodness.
So I thought I was going to die. I was like, this is how I die. I'm going to go under the knife on my 30th birthday in the hospital I was born in, and I'm going to die.
That was not deliberate.
And I was so stressed. And then I remember on the day seeing you and the team, and some of them were wearing like Aboriginal print stuff and just feeling like, oh, actually everything's going to be okay. And it was wonderful.
Oh, that's so good to hear. It's one of the things that has been really joyful for the last few years for me, finishing my degree and getting my own lists, was really educating the staff in theatres about what I do, because most of them cottoned on that the majority of my patients were mob, and they're like, oh, this is interesting. Why? One of them actually asked me one day, why is a bunch of your patients mob? And I said, oh, I'm an Aboriginal woman. So that started a whole conversation, and then it started a whole conversation about going to a wobbical and how that's helped mob seek women's business help, because it's really like, it's such a almost a stain on medicine's reputation in terms of how we've treated women for years. And you were a classic example of how many doctors, oh, she's anxious. Oh, she's just, it's stress, it's depression, it's anxiety. It's not an actual disease process. And it's so embarrassing for my profession that it takes, up to 6 years for women to get a diagnosis. And I think one of the great things that I'm really proud of from my college advocating for the last couple of years is really changing that mentality, and now knowing that, you don't necessarily need a surgery, but we, if you've got the symptoms, we can diagnose you and start treatment and get up to surgery if we need to. So you were a perfect example of everyone ignoring you.
Yeah. And I didn't know any better. Like, I didn't know that was a thing that existed. I didn't know what to compare my symptoms to. And none of my symptoms were mental. They were all physical. And so it was so confusing, and I am quite trusting naturally. And so it was so refreshing. It's actually one of those burn in my brain moments, the way you turn on a chair, you're like, you ever read your own medical notes? And I was like, no. I didn't even know I could. And now I'm really careful with reading the notes.
Yeah, it's a very important thing, and it's certainly something that I myself never did, my family members. You go to the doctor, you respect, they're the professional in the room, and you just sit there and do what you're told.
Yeah.
But, learning my degree and where it's got me, it's really cemented how important it is for patients to be involved and to know what's written down, because doctors are human. We can misinterpret, we can misunderstand, and it's reading those notes where you can actually find, well, who are you gelling with, who you're not gelling with. And I think one of the main things I like to tell everyone, and it's even, comes back to me, if you're not gelling with someone, even if it's me, find another practitioner. You don't have to stay with someone who's not listening to you, even though, my mum would have never changed doctors, even if they were dismissing her, and she was. It's interesting bringing up my mum, because she passed away 7 years ago of a very rare disorder, mitochondrial disease, and I think she went through maybe 15 years before that of being told she was a drug seeker. Before, and that's even with her daughter in the room, who's a doctor at that point, an intern or a resident, sitting there going, no, she's not, like, this isn't normal, like, she's dropping stuff. Yes, I know she's been taking those medications for a long time, but there's new symptoms here, and how hard it was to get some people to listen.
Yeah.
Because, he's a Aboriginal woman who was complaining, was anxious, was depressed, was, drug seeking. So it's a long battle with the public health system and getting people to listen to women specifically. Like, this just, the same thing just doesn't happen with men. Like, the medical, misogyny is real. It is debilitating for many patients, and especially Aboriginal women.
Yeah, I think how common it is for Aboriginal women to be treated as pain-seeking, and the result of that attitude and the resulting medical neglect often being death for our loved ones.
Yep.
Is I'm a bit emotional.
It's all right, I will cry on you if you can.
It's do you want to pass me the tissues that is behind you? But, like, my mum, for a couple of years, went to different hospitals because she was in so much pain. and they kept sending her home with Panadol, and they said she was just drug seeking. And it didn't matter that, like, I know in one of her times she even said to them, like, if I wanted drugs, I can get drugs. Like, you get them from the street. I wouldn't come and wait and, bring these symptoms to you. And in the end, her symptoms, my sister and I were looking them up, and we were saying these are classic symptoms of lymphoma. Like, this is a blood cancer.
Yeah.
And saying to Mum, like, all right, Mum, we've got to push back. We've got to push. But it was for several years, and she went to so many different hospitals and was sent away each time with Panadol. And it wasn't until she went to the RPA, and then she was immediately put in oncology, and we were like, okay, they're going to listen. And we still had a lot of issues there, but, Mum did die of lymphoma, and you just go, oh, what if we'd been able to start treatment a few years earlier?
Yeah.
So I'm very sorry for your loss.
No, yours too.
And I'm sorry for our loss.
Yeah.
And
our community's loss. Like, I feel like that's really had such a negative impact on culture and community, and it's just simple things as health professionals not listening. They're just not listening.
Yeah.
And it's, institutionalized racism. I can talk to you about for hours and hours in how the public health system is, an active participant in it. Like, there is no real attempt to remove it from the system, which is always very disheartening. But it's so interesting because, and even my department at John Hunter, they try, and they do try to get me involved and stuff. And, they ask the right questions, but sometimes they just can't execute. And I get really frustrated with them. In saying that, like, when we did an audit of the gynecology clinic at John Hunter to be like, okay, what's going on with mob in this service? How can we do better? And we realised that there was a 30% did not attend rate for Aboriginal women. And it was mostly on their second appointment. So something was happening in that first one to make them feel like coming was a waste of their time, or they didn't feel heard, or maybe they felt unsafe, or maybe they just didn't feel welcome. And when the administration were like, well, come sit down and talk, and we got all the Aboriginal health workers in the service to sit down, and we're like, well, what's going on? And we're like, well, it's probably they just don't feel welcome here. And then we're like, why? Why don't they feel? It's the same for everyone else. But I'm like, well, actually, it's not the same, because I can guarantee that every First Nations woman coming to this clinic, or them, coming to this clinic, have had someone be mistreated by the health system.
Yeah.
And so you're coming from that negativity in the first place.
Yeah.
So you're already being brave by coming to get help. And maybe we could just acknowledge that bravery a little bit. And so we put together this initiative where we did essentially a welcoming when women come to the desk. So I don't know if you know, but for any patient coming into the hospital system, they have to ask, are you Aboriginal, Torres Strait Islander? And that's just for data collection. Yeah. And we know that. We know that as well. That's a tick box exercise. That doesn't mean anything apart from you want to know for your data, and probably flagging to people who might be a little bit racist.
Yeah.
And I was like, well, that's racist in and of itself, because you're pointing people out for their ethnicity, and I get why you're doing it, because you want data, but the way you're doing it is
there's no reciprocity. It's not like you're getting anything. We don't get anything for telling you except for increased risk.
Exactly. And that's what I explained when I said, well, what can we give them? And so we did this welcoming initiative where we got Arnie Soretta to do an artwork for us. We put it on their patient notes, and and it's controversial, but I gave the non-Indigenous mob at the hospital a bit of a script to say, because I was like, because they already feel anxious. Like, the ones who are actual allies do feel like they're going to stuff it up. So I don't know if I can swear on this. I almost stuff it up. And so I said, oh, look, I just want you to welcome them, just like you were, doing an acknowledgement of country, but just welcome to their clinic, because this is a clinic for them. That's what public health is. It is a clinic for healthcare for the community. We're not here because we want to make money off people. We should be giving what the community needs. So it's their clinic. So acknowledge that. I want to acknowledge you. as a First Nations person for coming to this clinic, which is on a Wabakal country. Just say that. Say that and say, if you need anything while you're here, just ask. We know it's hard for you guys. And they were like, this is weird. And it was interesting because we got a couple of people were so resistant to it. They were like, oh, this is just going to make the non-Indigenous people feel bad. And I said, I don't care. They're turning up anyway.
Yeah.
Let's focus on the guys who we're scaring away. But we did that, and then we actually got, and it was such a simple thing, but we actually got our DNA rate down to 15% just from doing that alone, just from making an effort to have people feel seen and heard and like they belonged in the system. Like it was actually for them, because it is. And that's one thing that I'm very, very vocal about. If you ask any of the guys I work with, I'm like, this service is for them.
Yeah.
And I think we forget that.
That's a fantastic result.
You know, well, it was pretty good for something so simple.
Yeah.
And, you know, there's still a long way to go in the hospital system in terms of institutional racism and the systems that are set up that are innately racist and that people don't want to change because they think it's not.
Yeah, the pushback. The pushback's
exhausting.
a lot. Yeah.
Yep. But we're trying to get more research and stuff. You know, you find when you've been in the white system long enough that they will only respond if you respond in their language. So I think as unfair as it is, we do have to assimilate into their way to convince them, which isn't right, but it's something that we, you know, try to do by doing more research and trying to present them with the evidence that these things work.
Yeah, I hear similar things from various mob who are working in different systems, and it's that idea that you kind of have to learn to code switch. You have to weaponize the language back and say, okay, well, will this work? Will this work? Like what are you measuring? Because you value what you measure and you measure what you value in theory. And then saying, okay, what do we need to then, how do we get what we know, because community feedback and experience, how do we get that in a language that makes it actionable?
Yep.
So speaking of systems, did you grow up in a system that was like, yes, this is uni, this is, you know, this is how you fight the white system? Like, are you first in family to be a doctor?
God, I'm first in family to finish high school.
And how long does it take to be, how long does it take to become a doctor?
Good question.
Your kind of doctor, not my kind of doctor.
I'll take you back. I do want to, and I should have mentioned it at the start because it is so important, and I do want to give a good shout out to the University of Newcastle and what they do for First Nations mob in medicine and how they have led the way in the country for increasing the numbers. But I, not reluctantly, I always knew my mum was very good at being like, you got to get education. Like she didn't care what I did or how I did it or even if it was performative at best.
Yeah.
She was like, just keep the education going. Whatever you're learning, learn it good. And I knew I wanted to go to university just out of sheer, this is going to be a bit embarrassing. I grew up in the time of Sex in the City and a woman educated on a laptop just looked good to me. I don't know how I jumped from carrying Sex in the City to that's going to university, but that's what I did. And I actually just followed my cousin Sarah Smith, who's a Wiradjuri woman, who was like, come do this course with me, and it's a course called Your Pug.
I've taught on Your Pug. Your Pug's fantastic.
Did you talk? Like it's still going, right?
Yeah,
I'm sure it's still going. I've been meaning, because when I got my letters, I've got to go back and tell them, because I don't even think they know that one of their Your Pug people from when it first started has managed to get all the way to a subspecialty thing, and I really need to go back and tell them all, like Arnie Trace and
Pete knows. Want you to come and tell the students.
Maybe that's probably a good idea. Like it's so good, because what it did was, instead of pushing me into a university system that was quite foreign and quite scary, it brought me in gently to Wallatuka and to family and to community so I felt safe. And I made lifelong friends, Timmy Haynes, Shawnee White. I should thank them the most, because it was coming up to the end of the year when we were finishing that, they were like, come and interview for medicine. We're all doing it. Come and interview. And I was like, whatever.
So your PUG is a program that is run through Wonnarua at the University of Newcastle. And when it first began, its focus was specifically on bringing in more mob to become medicine students. It's broadened since its original concept. But the way it works is no matter how old you are, if you think that maybe university could be for you and it's something that you would like to do, it doesn't matter if you haven't finished high school. It doesn't matter if like what level of education you have. You can come in and I think it's a year. I can't remember if it's 6 months or a year, but I believe it's a year.
It's a year. Yeah.
And you come in and you do 2 semesters of like junior uni. So you come in and I've taught on it before. It was one of the first courses that I taught on as a baby academic myself. And we went over things like, what is an essay? What do people mean by academic research? And we went over the foundations of what you need to know to be a university student. And it is this scaffolded learning environment. There is a non-Indigenous version called Open Foundation at the University of Newcastle. I know lots of people who have gone in through that, but it's such a great program. And if you think that you would like to go to university and it's something you're interested in, each university has iterations of this, different versions of it. And you can go and have a question. I came into university through an alternative pathway. I didn't do your PUG. I was able to like write some essays because I'd been homeless and didn't get the score I wanted in year 12, but I had finished year 12. So I was still able to go straight in through another pathway at Newcastle University. But maybe you're not straight out of university, out of high school, or maybe it's been a while since you've studied, or maybe you wouldn't even know what would go into it. And in those instances, something like your PUG is wonderful. And at the end of the year, you get like a score, like this is where you've kind of landed. And then you can go and interview with the different departments and get entry to a degree, including medicine.
Crazy.
So that's a wonderful.
And I feel like they
PUG success story.
Yeah. I not that I was tricked into it. I honestly thought you did your PUG to do nursing. Like that's what I was doing.
Did you?
I thought, and there's nothing wrong with nursing. I thought nursing would be great. And it was so funny
from what you're doing.
Because they asked in the interview, why do you want to do medicine? Such a trap of a question because, you know, they're going to give you a hard time. So you say, all, you want to help people and stuff. And they looked at me and they said, oh, you could do that in nursing. Like you don't have to do medicine. And I must have just been in a bit of an attitude that day because I just turned and said, but why would I not want to do medicine?
Yeah.
Well, if I'm good enough.
Yeah.
And they just went quiet. And I thought I'd stuff that up. So I thought, oh no, I've upset the panel. But they let me on, which was crazy. And I mean, I managed to finish my HSE, but again with a mark that was not. Well, it was actually pretty good for someone who'd moved out of home at 15 and finished high school anyway, just out of sheer stubbornness. Go to high school, go work at Big W and go to bed was live off noodles.
Yeah. It was Macca's for me, but yeah.
Oh, Macca's. So it was I think it was like 40 or 50, certainly nothing that would get you into medicine, but it was also a nice, because I guess you kind of think that you can't, going to university was never something that anyone in my family had done or thought it was a good idea or thought, we could physically do it. You get told you're dumb enough long enough, you kind of believe it. But it was a nice, doing your PUG made me realise that what you learn in school or in your HSC is not necessarily what you're going to do in university. Like
no.
I did in the second semester I did chemistry. They just pop you in one of the other classes if you want to pick one, and I was like, oh no, I can actually do this. Like this is not writing big essays. I don't know how you write big essays, sis. It's not my thing. But I could do a bit of science and I could do it well, and it's I could get a good mark in that, and it wasn't going to bring everything else down. Like I feel like the HSC has a few things it could improve.
Absolutely.
But so I think back, I think I realised halfway through your PUG that they were trying to get more doctors out of us, they'd popped us into practice PBLs, which is how they teach medicine, in that group work and that group mentality. So it was very different from high school, and it was probably halfway through that I was like, oh no, I can do uni. So it was very, good positive reinforcement of, this is a good choice and you're, and when I got in, I just, nearly fell off my bed and decided to do it anyway. And then just to throw another spanner at life, I fell pregnant halfway through first year.
Oh, wow.
By accident. And it was one of those
classes yet?
No, apparently not. I know, the shame. It's one of those things where everyone's like, how could you not have known? Because people get a good kick out of this, but I was 19 weeks when I found out. So I kept getting periods, didn't think anything, and I was skinny back then, and it wasn't until someone said, you look a bit fat in a non-nice way, and I was like, oh, okay, maybe I'm all right. Did a pregnancy test, positive. And pro-choice lassie I am. I went, nope, this is the wrong time. I'm going to go and not deal, I'm going to have a termination. And I got there and I had a very awful, awful person who just treated me like I was an idiot, who was like, you're like 19, 20 weeks pregnant. He was really, really awful. And then I went, well, that's okay. I'm having a baby. It's fine.
So you thought you were earlier as well?
I thought I'd missed one period No, I had my period on my birthday. So I know when I had my bleeding anyway, it clearly wasn't a period. And in retrospect, I was probably having a bleeding, subchorionic hematoma that I now know is a thing.
I should laugh, but this is so many menstruating people I know, this is their nightmare.
It's a nightmare.
It's like a surprise or like a cryptic pregnancy.
Yeah. And so I have this huge, if anyone finds out they're pregnant later on, I'm just like, it's okay, mate. It's okay. I'm an obstetrician. I missed it. I was bleeding. You don't think that that's a thing. I was on the pill. What are you supposed to do?
You weren't sick?
Nope.
Oh
which is just the devil in the details, really, isn't it? I had my third pregnancy and I was sick as a dog, and I was like, where was this the first time? Where was this acknowledgement of the pregnancy?
I'm vomiting, wetting myself with the force of the vomiting from the moment I conceive.
Oh,
so it's I know the moment that's amazing.
I was climbing things. I was working at Big W up ladders. I was doing all sorts of crazy stuff at 20 weeks pregnant.
Experience with the male doctor that you saw.
It was and I just couldn't understand why he was being so awful to me. I'm like, you work in this clinic. You have made a choice to help women in one of the hardest things that they can even remotely consider. It's not people think it's such a whim thing to terminate a pregnancy. There is no, it is days and hours and minutes of what am I doing? Yeah. Is this the right thing for me? Because pregnancy changes your life, whether you want it to or not.
Yeah.
And, obviously I was in my first year of med school. I thought I'd finally broke some barriers and then I was pulled right back. But Phoenix has he's my son, Phoenix. He's turning, 22 soon. And he knows I went to have a termination, and he likes to think that he's the guy that snuck through. And I was like, yeah, you were. And it was a good thing in the end. I can't say anything but that. But it's, it's such, and he knows too, and that's why he's so careful with his girlfriend and making sure, and he's very pro-choice as well, because he knows that as a single parent trying to get through med school and the poverty we experienced and I ended up in a DV relationship because I thought I had nowhere else to go, and I'm trying to finish med school. And he knows that if he wasn't born then, that things might have been easier.
Yeah.
So, I've had so many people say, why would you say that to him? I'm like, because I don't want him to do the same thing. I want him to have babies when he's ready to have babies, or when he wants to have babies. That's nothing to say that an accidental pregnancy is not the best thing that can ever happen to you.
Yeah.
But it's complicated. It's way more complicated. And for that male doctor to just sit there and be like, you're an idiot. How could you not know? It was a bit destroying, because I think at that point that was the only time I'd ever thought I can't be a doctor because I'm an idiot, because I didn't know I was pregnant until I was 19 weeks. And it was nothing like that. That was just the way. Pregnancy, the thing about obstetrics that I love so much, and I say it a lot, And most people think I'm having a laugh, but I'm not. Like, it's a little bit of magic. It's a little bit of witchcraft. Like, we are never going to be able to control this beautiful thing that is creating humans. And we're never going to be able to do it without some sacrifice to our bodies, to our mental health, to our emotional well-being. What we give as women to our babies is magic. It's from the ancestors. It's from, the stardust that is around us.
And the risk to carry babies, the risk to our lives to bring them safely into the world.
We don't talk about that.
Like to have my third baby, my third pregnancy, I had to have a C-section because there was a fibroid in the way that I didn't know I had. And that was why we had a scheduled C-section, and we were very fortunate that when we said, hey, we'd really like to bring someone in for cultural reasons, and we said we wanted Dr. Leila in the room, that we got a yes. But things did go wrong in the surgery, which wasn't Leila's fault. Leila wasn't the one doing the surgery at that point.
Side note.
Leila was there we were rocking out to music, and then things went really, really wrong really, really quickly. And Luke remembers the blood on the floor and on everyone's shoes, but they were your shoes. Leila stepped in. Essentially, someone cut something they shouldn't have cut, and I lost 5 litres of blood very rapidly. And if I wasn't in that hospital, if Leila wasn't in the room, if I wasn't 6'1", because I had a little bit of extra blood, the average person doesn't have as much blood as, the average birthing person is closer to 5 foot than 6 foot. And if you weren't in the room, I would have died. And I was in that in-between place. I remember everyone coming in. I remember the room filling with people and Luke being terrified that, but because of, what then was done to my body to save my life, I wouldn't be able to safely carry another baby. And so if I was to become pregnant, it would be choosing between staying for the children that I've got or ending the pregnancy. And I don't think people recognize the risk. Not only being sick every single day, I was hospitalized almost weekly for the 38 weeks to get fluids because I get hyperemesis gravidarum or however you say it, HG. But to get the baby out, and before C-sections and interventions existed, we just both would have died. Because she never would have been able to get out the birth canal because of the fibroid. It was life-saving what you did, but also, it's life precious work. It's to have babies is so risky.
It is so risky. It is. And that's not to say there aren't those pregnancies that are just easy and smooth. And my sister's one of them that just, has this beautiful birth that's not requires no intervention and just requires, awe of those in the room. But, it's still bringing a life in the world, and you still, there is risk. And if we were in third world countries, and there are many women who lose their lives for this or lose their baby in the process of trying to do this. And
well, that's the pushback on things like ultrasounds.
Oh my God.
And they say just trust your baby. Because I had 2 natural births before this one. My son, 11-pound, giant baby. I roared him into this world with no intervention in a bath, in a birthing centre. I could have had every reason to be I'm not gonna get an ultrasound. I don't need a doctor. I've done it twice. I was walking myself down for a coffee a few days later. But I had a fibroid that I didn't even know was there. That was a boulder in the canal.
It was. You're not wrong. Huge. You're not wrong. You had another baby sitting there.
20 centimeters.
It was good. It was good. It's gone, and it's just one of those things that I tell because nobody likes to be told that things are different this time, but we every pregnancy is different. It's a different genetics inside you. It is different placental location. It is different. You as an aging person is going to be different, and that's okay. There's nothing wrong with that, and there is no shame to be had in childbirth. It is amazing what every single woman goes through to bring a life into this world. And no one should ever comment on someone else's birth. That's theirs. Let them have it. And that's not to say that there isn't birth trauma. Trauma, from having babies is absolutely real. You lost 5 litres of blood. How is that not traumatic?
Yeah, it was traumatic for Luke as well because the visuals, like he literally watched me because I was an active resus, right?
Yeah.
Yeah,
you were getting an active, what we call an MTP, so a massive transfusion protocol. So you had like 4 people, bringing you essentially what is the entire, makeup of your blood volume, which is not just red cells, it's plasma, it's cryo, it's a whole lot of things because it's not just about replacing the red cells, you've got to replace everything else so that you can clot and stop bleeding. So it's you were in very much active resus. Shout out to Tom, the anaesthetist, who picked up very quickly. I love Tom. He's probably my favourite anaesthetist because he never shies away from obstetrics, which is delightful. And I probably do owe your lovely husband an apology because I still remember him coming up to me once and just going, "So how bad was it?"
Oh,
and because of me, because it was me, I was just like, "It's fine," because I've done this so many times. I felt like I totally dismissed his feelings, the poor things, and I was like, "Oh no, wait, that would have been frightening for anyone in the room."
No, he handled it really well. He was scared that he would be removed from the room, so he went into actor mode. But he was,
we used to do that.
Out.
Again, it's one of those pride things of my specialty in the improvements that we've had over the years is that we don't remove people when there's an emergency now because they need to see it. They need to see that what we're doing.
I assumed everyone was just so busy saving my life that they didn't have spare hands to remove him. Oh, that was intentional.
It's intentional because we've realised in retrospect that when you remove people, what they have in their imagination is generally worse than it seeing it, and that there is an element of being able to process the trauma better if you can see the commotion in a sense. It's why even in ED, in trauma resusces, if a family member wants to stay, they will not remove them now.
Well, I've gotten a lot of nice gifts. Because I think every now and again Luke remembers that I almost died in front of him and he thinks I should get Amy a little appreciation gift. That's so including my beautiful.
Oh, very nice. That's one of them.
Yeah.
Stunning.
But right, so you had Phoenix and then how many years until my dad was like, "So you're going to quit medicine?" I was like, "No, don't be stupid." It's just a medical
so
degree.
Much of my mum and me. I love my dad, but so much. I'm just, why would I stop? It's such a funny concept. But so the medical degree at Newcastle is 5 years. It obviously took me 7 because I came back when Phoenix was 3 months old, which was probably a bit too soon. Failed an exam, but then went and redid it and passed every exam since then, which was good.
That's phenomenal.
It wasn't too bad. I should shout out a bunch of my uni friends who were in my PBLs and were in my lectures because they were kind and let me bring my son to lectures and he would sit down the front and play while we were learning anatomy with some pretty impressive pictures on the wall. So I'm glad he didn't quite know what he was looking at, but it was nice that they were so kind and accommodating. And then so you do your 5 years. Some universities it's 6, and then you do your internship and your residency. So that's generally 2 years. That's your mandatory requirement after you get your degree to say that you're a doctor at the end of that. So you get registered, but then you get formally registered at the end, and then you start to work out where your degree wants to take you. So at the end of my residency, I applied for peds, obstetrics and emergency. Clearly I like a bit of adrenaline in my life. And I'd love to say that I always wanted obstetrics, but they just offered me the job first and I went, must be the one. And I never left. So I did 2 years. I should probably add that I had a baby in first year and then I had another baby in fifth year.
But we knew by then that we had pregnancy.
Well, that one didn't bleed, see?
Right.
So I do think it must have been a subchorionic hematoma.
Yeah.
Because they couldn't have been periods. obstetrician now. I've learnt some things. But yeah, and there was active trying in that thing, so actively looking. And then I did what you call sort of pre-training years. So I did 2 SRMO years because I had my third baby in that time. So it was about essentially 18 months of what you could see senior residency in obstetrics and gynecology. And then it was in that time that I was applying to get on the training program, and I managed to get on my second go. And then more training. So the actual FRANZCOG program is 4 years of core training followed by 2 years of pre-vocational fellowship, so the core training is where you kind of learn a bit of everything. So make sure that you can be an obstetrician and gynecologist, because obviously in Australia, you can subspecialise in the tertiary centres, but if you go regional or rural, you need to kind of be able to do both. You can't just be an obstetrician and you can't just be a gynecologist, because those places, can generally only afford 1 or 2 specialists, and they kind of need them to be able to do the emergency stuff. So that took me, so it was 6 years, and for me, just because of lots of different reasons, sorry business, grandparents passing away, my mum getting sick and passing away, and then my dad getting sick, and I shouldn't laugh, it's that awkward trauma response that I have, that I think it took me 8 years to finish. And I think the 2 main struggles I had was one of the written exams, and this is just to tell mob out there that it's okay to struggle with a westernized test, and not to give up, because it's not you. You're just not quite understanding what they're wanting from you, and there is an art to that, and a lot of other people have resources where they can learn how to do that, whereas we don't. So that's something I'm doing. I've just taken over the chair of the First Nations Women's Committee for FRANZCOG, which Marilyn Clark has been doing for like 8-9 years, which is Kelvin's sister. I love it a bit. She's my mentor. And I'm trying to make sure that we when we get people on the program, we're setting them up to pass and not have those barriers that I did. So that, and then the research project, they expect you to do this giant, massive, complete research project and give you no tools to do it. So, it was not without struggle, hence why it was 8 years instead of 6, but I got there in the end, and this is my 3rd year as a consultant. So I guess it's one of those interesting things, because you realise in the public system when you're interacting with doctors, you might be interacting with someone at the start of their training, the end of their training, or the finalised specialist. It's hard to recognise that when you're a patient. So
it freaks me out a little bit because I'm now old enough that sometimes the doctor is a bit younger.
Oh, yes.
Like, okay, this is happening.
I mean, there's certainly something to be said about, I think my height does not help me sometimes, and also my gender. I've certainly had the experience of a surgical fellow addressing the male registrar next to me as the consultant, and even when you highlight that perhaps they're not the consultant, they don't even offer an apology. I think that's something I would really like to see change. It's okay to think that someone isn't who they are or is of the different level.
Make an
just
incorrect
apologise.
assumption. Yep.
Just say, "Oh, sorry. Let's talk to you now because you've done the 7 years and they're on their first."
Yeah.
But I think that's something that I would really like to see disappear. Is if you completely, make an assumption about someone and you're wrong, it's okay. Just admit it. And I never, ever feel bad about being mistaken for a nurse or a midwife, but I will point it out, and I will have midwives right behind me say, "She's a doctor. She's done extra years. It's okay." Say sorry. I love midwives. They're the best. There's a certain sass that midwives have.
They're very earthy.
Yes.
They're down.
Yes.
In the birth trenches.
That's right. They've seen the beauty and they've seen the beasts that can appear when, women are truly, truly unwell.
Mm.
COVID, it's, you're talking about COVID before, but I still just remember spending like 7 hours with a midwife and a labouring woman in full PPE, sweating and just trying to get them to the end because you don't want them to become unwell and you want the baby to come safely. But what midwives had to do, because, I never had to do that often. I could come in and out, whereas they would be like in that PPE. And I don't know if you've noticed, but or if you've ever been around a labouring woman, they don't tend to keep still. And it's a marathon. They're moving, they're doing what they need to do, and to, try. I still remember the hospital desperately trying to put rules in place for labouring women. And they're like, no, they have to have this mask on. I'm like, no labouring woman is going to cope with a mask on their face. Just protect yourself.
Yeah. Especially when there's quite an instinct to strip off completely.
Exactly.
Labor,
exactly.
For many people. Well, that's phenomenal. I think final question that I'd love to know. So I'm a PhD supervisor at my workplace, and something that I tell students, or even if they're not my student directly, but they come to me for advice, when we've got sorry business, when money gets tight, people get sick, is the time's going to pass anyway. If it's something you want to do, just keep going, because those difficulties aren't going to stop for us, unfortunately. And the shorter time period you can get through it, the less of those things you're going to have to deal with while you're doing it. But how did you keep going? When you hadn't slept because of the babies, and everyone got gastro that winter, and your mum had passed away, and you had all these difficult, hard things. At some point, you must have felt like quitting. Why didn't you? How did you keep going?
Good question. I think there's probably lots to the answer, but I think there is also an element of finding something you love that just makes you go back to it anyway. I do love what I do. When I help birth a baby, or help, someone who's petrified get through something really scary with a positive outcome, or even just helping someone through a stillbirth is actually quite profound and special in its own way. And even is just going to, stopping a woman from wetting herself when she sneezes is quite quite magical. So my job is just beautiful and I love it. But in terms of the crux of it, and you're right, the finances. One thing is the amount of people that assumed I went to uni for 100% free was pretty. I'm just like, guys, one of my most beautiful friends was like, I just wish I didn't have a HECS debt. You wouldn't have had a HECS debt because you're Aboriginal. I was like, I paid my $75,000. Thank you.
It's got to be one of the most prevalent myths.
It's such a myth.
Yeah.
But yeah, the amount of debt I finished my degree with, and the fact that I'm trying to start private practice with, I don't have anything. I don't own a house. I can never quite get that deposit or the backing because of the amount of debt that's followed me through. But I think what my mum thinks, and that is that, our job as parents is to just get our children to be a little better than we were. And so when, I finished medicine and how proud she was, it just kept me going to keep going. And even when my grandmother passed away, right around interviews to get on the training program were, and I obviously felt such community pull to go to that funeral, even though it was on the same day. And it took 2 uncles, 2 aunties, and another elder to be like, you go to that interview because your grandma will wake up and come flog you.
Yeah.
So, it was community pushing me forward and giving me a break when I needed it. And it's the advocacy that I keep doing moving forward. So I actually wrote an article for the FRANZCOG magazine, O&G Magazine, which was just on what allies and that can think about. And it was really just things like, well, you know what? When I was going through my degree, we have a large amount of sorry business. That's, it's just going to happen. We come with debt. We come with families. We come with community requirements. And we're not trying to be lazy. We're not trying to get out of work. We just need some understanding. And it was colleagues that would give me those understanding and give me that it's okay, keep going, that helped me get to the end. Because I think without that going, oh, this is okay, like VJ Roach, he was one of the presidents of the college while I was going through, and I had to email him because I just couldn't. I'd had another death in the family, and I just couldn't get this research thing done, and I put it in for the last time and it got rejected again, and I just emailed him at like 2 a.m. I don't even know why. I would never normally do that, especially to a male. But I was like, I just can't do this anymore. I need to quit. And he just helped. So it's surrounding yourself with people who are in your team, who want you to finish. And it's easy to get drowned out by the voices of negativity. But there are positive voices, and you just need to keep them close.
I love that. What a great note to end on. I think sometimes we're the person who needs support, and sometimes we're the people who have a little bit of extra energy or extra seat at our table or a little bit of time. And I think that one of the beautiful things that we have as a community is this willingness to kind of pour into the communal space, knowing that we will take from it when we need it. And sometimes it's our turn to be in the cups of others. So thank you so much for coming and filling my cup and sharing your stories with the listeners. I feel very grateful to have access to you for this. Like, you're one of 6 Indigenous doctors?
There is 6 now.
In the role in the country.
Yeah, obstetrician gynaecologist. I was number 5, and we've just had another one finish, which is very exciting.
It's very exciting, and maybe number 10, 11, 12 are listening.
That's right.
Today.
That's right.
But thank you very much, and thanks for listening.
Pleasure.
Yalu.